Welcome back, everyone, to the Deep Dive. Ready to unpack a topic that's generating a lot of buzz?
Absolutely. Always up for a good deep dive.
Today, it's all about compounded bioidentical hormone therapy for menopause. We've got some fascinating research to dig into, including that new clinical consensus from ACOG.
Can't wait to hear your take on it. It's definitely been a hot topic in the endocrinology world lately.
Hasn't it, though? My inbox is overflowing.
Mhm.
But before we get lost in the weeds, let's start with the basics. When we say bioidentical hormones, what are we actually talking about? It sounds simple enough, but something tells me there's more to it.
You're right. It's a bit of a tricky one. Bioidentical just means these hormones are plant-derived and chemically similar to what our bodies produce naturally. But, and this is important, that includes both FDA-approved medications and those made by compounding pharmacies.
Ah, there it is. The plot thickens. So it's not as clear-cut as bioidentical equals good and synthetic equals bad, which, let's be honest, is how it's often portrayed, right? Especially when you look at the marketing around compounded therapy, all that natural and tailored talk can be pretty persuasive.
Oh, absolutely. It taps into that very human desire for treatments that feel less like, well, pharmaceuticals,
Yes.
more in sync with our bodies. But as we know, natural doesn't automatically equal safe or effective,
Mm.
especially not when we're talking about something as complex as hormone therapy.
Exactly. And speaking of safety and effectiveness, you sent over that new clinical consensus from ACOG, and let me tell you, it's a doozy. They actually advise against routinely prescribing compounded bioidentical hormone therapy if there are FDA-approved alternatives available. That's a pretty strong stance. What's behind that recommendation?
Well, there are a couple of key points that really jump out. First off, the evidence supporting the supposed benefits of compounded treatments is surprisingly thin. It's not that they've been proven harmful, more like we're missing those large, robust, well-designed studies needed to give them a definitive thumbs up, especially when it comes to long-term effects.
So it's more of a proceed with caution situation then. Like we need more data to really know what we're dealing with here.
Precisely. And then on top of that, you've got the whole issue of the compounding process itself. It doesn't face the same level of FDA scrutiny as those commercially available medications do.
Right. And that's a whole other can of worms, isn't it?
It really is. It raises all sorts of questions about dosage consistency, ingredient purity, even the potential for contamination. We're talking about hormones here, potent stuff. Even tiny variations can have a big impact. It's not to say that every compounded product is automatically risky, but that lack of standardization is definitely a red flag that ACOG is right to highlight.
It reminds me of that saying, the dose makes the poison. Even something natural can be harmful if you're not careful with the amount or preparation. And speaking of research, a lot of what we have on compounded therapy is observational, right? Does that carry the same weight as, say, a randomized controlled trial? Asking for a friend who might not be totally up on their research methodology?
Huh. Great question. And an important one. Observational studies definitely have their place, but they don't provide the same level of evidence as those gold standard randomized controlled trials. With observational studies, you often don't have a control group, which makes it really hard to tease out whether it's the treatment itself or other factors that are influencing the outcome. Plus, they tend to focus on short-term results or surrogate markers, which don't always translate into tangible benefits for patients in the real world.
It's like they say, correlation doesn't equal causation. Just because some women using compounded therapy see improvements doesn't mean it was the therapy that caused those improvements.
Exactly. And that's why those robust studies are so crucial. We need that solid evidence to separate real effects from everything else that might be going on.
Absolutely. And you know what really hammers that point home? He sent over this fascinating 2004 Cochrane review. They found a massive placebo effect, almost 58%, in women taking hormone therapy for hot flashes.
Oh, wow. I remember that one. It's incredible, isn't it?
It really highlights just how powerful the placebo effect can be.
Yeah.
And it underscores why we can't just rely on anecdotes or observational studies when we're evaluating these therapies.
Hmm.
We need solid data to tell us what's really going on.
Absolutely. Couldn't agree more.
It really makes you realize that our minds and bodies are capable of amazing things. But okay, let's move on to another layer of complexity here. Testosterone therapy during menopause. There's no FDA-approved testosterone specifically for menopausal symptoms, right? And yet it often pops up in these compounded treatments. It feels like a bit of a gray area, ethically speaking.
It definitely is. And it really highlights how important those open, honest conversations between patients and their providers are. ACOG is very clear. Start with those FDA-approved options first because we've got that reassurance of safety and efficacy data. But we also have to acknowledge that for some women, testosterone therapy might be beneficial, even without a specific FDA-approved formulation for menopause.
So how do we reconcile those two things? It's like walking a tightrope.
Exactly. It takes careful consideration of each individual patient's needs, weighing those potential benefits against the unknowns when it comes to long-term risks. There are studies out there suggesting that testosterone, particularly in combination with estrogen, might help with things like low libido, vaginal dryness, even some mood changes. And for some women, those improvements could be life-changing.
Absolutely. Quality of life is so important. But if I'm hearing you right, we just don't have that same robust long-term safety data on testosterone for menopausal women, particularly when you look at potential risks like certain cancers or cardiovascular disease.
Exactly. And that uncertainty gets magnified even further when we're talking about compounded testosterone. You don't have that same level of standardization and regulation as FDA-approved meds. It makes those risk-benefit conversations even more crucial.
It really is all about informed consent then,
Yeah.
making sure patients have the full picture to make the choices that are right for their bodies. Now, we can't talk about compounded testosterone without mentioning pellet therapy. It's like everyone and their mother is asking about it these days.
Yeah.
Based on your research, what's your take on the whole pellet craze?
It's definitely having its moment in the sun, isn't it? And I get the appeal. Pellets are long-acting, so you're off the hook from remembering daily pills or creams. But that's also where a potential downside comes in, too. They're designed to dissolve slowly, so you don't have that easy off switch if a patient has side effects or decides it's not for them. With other forms, you just stop taking them.
That is a huge difference. It makes you wonder, does that convenience outweigh that lack of control, especially given all the unknowns we've been discussing about those long-term safety concerns? Were there any studies in particular that jumped out at you, either for or against pellet therapy in this context?
Honestly, a lot of the research out there on testosterone pellets lumps pre and postmenopausal women together, which makes it really hard to isolate those effects and risks specific to menopausal women. So, more research is needed.
Isn't that always the case, especially those larger, longer-term studies that focus specifically on menopausal women? I feel like with testosterone therapy in general, we need to move beyond just looking at lab values and really focus on how women are feeling.
Mm.
Are their symptoms actually better? Are they experiencing side effects? How's their overall quality of life?
100%. It's about the whole picture, not just numbers on a page. And that actually brings us nicely to hormone level testing, another topic that's not as straightforward as it might seem, especially when it comes to compounded therapy.
Oh, hormone level testing. It seems so simple on the surface. My levels are low. I need some replacement hormones. Done and done. But it sounds like ACOG even completely sold on that approach, at least not for compounded treatments. What's going on there?
You hit the nail on the head. While it might seem intuitive to test and treat based on levels alone, ACOG actually advises against relying on hormone level testing to guide compounded therapy. It's not as simple as saying, okay, this hormone level corresponds to this compounded dose. It's much more nuanced than that.
Oh, interesting. I think a lot of people, maybe even some clinicians, operate under the assumption that knowing your levels is crucial for personalized treatment. What's the rationale behind ACOG's stance then?
Well, there are a few key points to consider. Firstly, individualized hormone level testing, whether it's through saliva, serum, or blood tests, is most useful when a drug has what we call a narrow therapeutic window, meaning that even small changes in the dose can lead to big changes in effect. And D, those levels need to directly correlate with how well the treatment works clinically. We also need reliable and accurate tests. And steroid hormones like estrogen and progesterone don't always fit neatly into that box.
So it's not as straightforward as saying low estrogen, therefore we give compounded estrogen, even though on the surface it seems to make perfect sense.
Right. And then you add in the fact that salivary testing, which is often touted as this natural approach, isn't actually all that reliable for accurately measuring these hormones. It further complicates things.
Wow, good to know. I can see how that would muddy the waters. So if we're not supposed to get too hung up on hormone level testing for compounded therapy, what is ACOG recommending when it comes to dosing and monitoring? We can't just be throwing darts in the dark, right? So what's the alternative then? If we're not basing it on those hormone levels, how do we figure out the right approach?
Well, ACOG is actually pretty clear about this. They really emphasize symptom relief as the primary goal. It's not about chasing specific hormone levels, it's about finding that sweet spot, the lowest effective dose that eases those bothersome symptoms while minimizing the potential downsides. And that sweet spot, yeah, it's going to be different for everyone.
Makes sense. It's all about individualized care and shared decision-making then, right? Which brings us back to those all-important conversations between patients and their providers.
Exactly. It's a two-way street.
And this feels like a good moment for a little reminder to everyone listening. It is never too late to have these conversations. Whether you're just starting to think about compounded therapy or you've been using it for a while now, staying informed and advocating for yourself is so important. What are some good conversation starters? What should we be asking our doctors, especially in light of this new guidance from ACOG?
Such a good point. It's not about writing these therapies off altogether. It's about arming ourselves with information. So, first and foremost, if you're struggling with symptoms, don't suffer in silence. Talk to your doctor. Then ask about all the options, not just compounded, but FDA-approved ones too. Don't go in with assumptions about one being inherently better or worse. Let's have a conversation based on the data.
Love that. Data over dogma, always. And I imagine those conversations should go beyond just a general overview too, right?
Absolutely. Don't be shy about getting into the nitty-gritty. Ask about the potential benefits and risks of each option. What does the scientific evidence actually say? Are there any concerns about the quality or consistency of the compounded preparations? What kind of monitoring is involved? How will we even know if a treatment is working for you specifically?
Those are all fantastic questions. Seriously, we should print them on wallet cards or something. Now, while we're on the subject of FDA-approved options, let's not forget that those DO exist in the bioidentical realm. It's easy to get so caught up in the compounded conversation that we forget that's even an option. Can you remind us what those FDA-approved bioidentical options look like?
Sure. For estrogen, you've got options like oral tablets, transdermal patches, gels, even vaginal rings. And then for progesterone, we have micronized progesterone, which is chemically identical to what our bodies produce, available in both oral and vaginal forms.
So there's a whole toolkit out there, even within those FDA-regulated boundaries.
There really is. And it's worth pointing out that some of these delivery methods, like patches for instance, actually offer much more consistent hormone levels compared to those oral forms, which tend to fluctuate more throughout the day. A big plus for women dealing with breakthrough symptoms.
You know, those are the kinds of nuances that I think often get lost in the broader conversation. It's not just about natural versus synthetic or bioidentical versus non-bioidentical. It's about making sure that every woman has access to the safest, most effective treatment for her based on her own individual needs and preferences.
Couldn't have said it better myself. It's about empowering women with information, choices, and a truly collaborative approach to managing their menopause journey.
Couldn't agree more. Well, this deep dive has been incredibly eye-opening, even for someone like me who thought I had a decent handle on this topic. The world of compounded bioidentical hormone therapy is clearly complex, and it's constantly evolving. Expert speaker, thank you so much for walking us through this nuanced terrain.
My pleasure. Always happy to have these discussions. They're so important.
And for our listeners, we hope you're walking away with a clear picture of what bioidentical actually means, the FDA's role in all of this, and most importantly, just how powerful it can be to have those open, honest conversations with your healthcare provider. Now, here's a final thought to ponder as we wrap things up today. Given the growing popularity of compounded bioidentical hormone therapy and all the debate surrounding it, what kind of research would be most helpful in truly understanding its long-term effects on women's health? Something to keep in mind as you continue to explore this topic. Until next time, everyone, happy diving.